All right, we have some, woo. Let's see, how's that going? Good? All right, good. So tell me, in the audience, raise your hand if you've heard about functional medicine before. Yay, about half. It's pretty incredible because probably 5 years ago there would have been none. And then maybe 4 years ago, maybe one. And now, granted it's a small room, it's half the room, which is exciting. I was really touched by the prior presentation because you could just feel the struggle of where he's been with the knowledge that he's had and how it can improve brain injury and recover from so many things that are chronic and hopeless before to now just seeing things that are miraculous and so touching. But he had that knowledge, but the knowledge wasn't accepted because it wasn't mainstream. And because it wasn't mainstream, it was debunked. And I think that it's interesting that in order to kind of bring it to the medical community, he had to legitimize it by having a program within a university. So enter functional medicine. Because functional medicine, you know, it's becoming, especially in Austin, I believe that we are the functional medicine capital of the world. We have some really amazing providers in Austin. Dr. Womack is here. She's one of them. She's one of the first pioneers, and I look up to her greatly. But nobody knew what functional medicine was. And now today it's like, okay, so is that holistic medicine? Is it just nutrition? What do you do? And why are people excited about it? So when I got my doctorate at Hopkins, I had to focus on a problem. And at that time I was doing primary care, seeing 20 patients a day, treating ear infections and doing well checks. And the people in the room that I had to go into, the non-vaccinators, the crunchy people, the tree huggers, the ones that, you know, wanted an alternative approach to health, I had no idea how to handle that visit. And I actually really dreaded seeing those people. So when I got my doctorate in translational medicine, or it's a doctor of nursing practice, the thing was, is what's your practice problem? And my practice problem was, I'm their healthcare provider, however, I don't know how to provide the type of health that they're seeking. I don't know if it's legitimate, scientific, or even, at best, safe. So I focused on how to, close the gap of what we know to how we practice. And so today we're going to talk about functional medicine and how that can apply to pediatric brain injury and pretty much all chronic illness. This applies to every chronic illness that anyone in this room has. So we're going to talk about how the gut and the brain are connected, how we can have different strategies for controlling inflammation. Just like HBOT, one of the biggest things it does is it turns off all those inflammatory signaling to help with growth and recovery and repair. Well, guess what? There's a lot of other stuff that you do every day that either is inflaming your body or that is helping it heal. And we're also going to talk a lot about, okay, so nutraceuticals, supplements, how does that apply? And what are some specific, we'll just touch on a few that can be helpful for brain injury. So functional medicine was pioneered by the Cleveland Clinic. And what it is it's a systems-based biological approach to treating chronic complex illness. So for instance, instead of the neurologist treating the neurological system and the gastroenterologist treating the gut and the endocrinologist treating the thyroid, why are we treating chronic disease in silos? In fact, everything is connected and our body is an interconnected set of systems, and one system that is imbalanced can influence others. So it's a scientific methodology of actually just looking at chronic illness in a completely different way. So in functional medicine, we truly believe that one condition can have many causes, such as depression can be caused by something like vitamin deficiencies, in particular vitamin D, or low thyroid, over antibiotic use, gut dysbiosis. And inflammation can also be the trigger for many chronic diseases like cancer, diabetes, and heart disease, etc. So one cause, many conditions, but one condition, many causes. And so chronic illness happens over your lifetime. A lot of times, you know, if you live long enough, you'll see that something chronic pops up. But in my work, because I deal primarily with children, I'm seeing it earlier and sooner. I'm seeing autoimmune very, very young, you know, even before they're entering kindergarten or elementary school. But chronic disease typically doesn't happen all at once. Now, pediatric brain injury, yes, but chronic disease, something like autoimmune disease, etc., there's usually something that comes before. There's an antecedent. So for kids, maybe it's their genetics was before. Something happened in their environment. Something happened that was traumatic, something that was disease-induced. And then it's triggered by something that triggers the antecedent, and then there's something that keeps it going, which is called a mediator. And mediators can be things like social reinforcements, to thoughts, to beliefs, to hormones, to inflammation. So what is mild traumatic brain injury? So when we talk about mild TBI, it's a misleading term because manifestations can range from mild symptoms to daily ongoing dysfunctions. And it is approximated that about 50% of people with mild traumatic brain injury will develop symptoms, and they'll be persistent and debilitating. So it's kind of this chronicity that is ongoing. We also know that after TBI, there's also a lot of traumatic ongoing pain, and here are some studies that delineate that. Just talking about the comorbidities after you have an injury, that you'll have sustaining other things that you continue to deal with. And that is, I like the first speaker talked about how there's dysfunction in the gut when there can be dysfunction in the brain. So this is the thing that I really appreciate about actually some psychiatrists here in Austin, that now when you're sitting down to do an assessment about depression, they're actually asking you about your bowels. Are you having chronic diarrhea? Do you have gas and bloating? What are you putting in your gut? Because we know if we don't ignore the anatomy of our vagus nerve, there's this bidirectional communication that's constantly happening. That's why a thought can become a feeling, while feelings can become thoughts too, right? Do you know those people that they get either really good news or really bad news, and they're like in the bathroom immediately? That's because our brain is connected to our gut via the vagus channeling. And because of that, is if there's inflammatory stress in your gut, there can be inflammatory stress within the brain. So we know that this disruption of the gut-brain axis from traumatic brain injury can lead to this chronic inflammation that we're talking about. It can have this kind of sequelae involving the brain and the gut and the both neuroregulatory and neuroimmunological loops. So this round and round and round. So here's another depiction of, okay, if we have environmental factors such as the thing that we're doing every day that is the absolute most thing that you have control over, that actually can perpetuate and mediate your inflammation, is what you're putting in your mouth. There's a saying by one of the founders of functional medicine, Mark Hyman. He says, the most powerful medicine is at the end of your fork. And I truly believe that, because we're giving our body information. So it can start off with things that are causing inflammatory stress, like if you're eating a food that's inflammatory for your immune system, if you have a chronic toxicity, so you're living in a house with water damage that you're constantly breathing in mycotoxin molds, you have stress in your marriage or your relationships, and all of that causes more inflammation, and it also causes something called increase in lipopolysaccharides, which basically we've discovered that the gut can actually become permeable and not absorb our foods and our macromolecules the way that we need to. So we just have this constant storm of inflammation that's happening. Those inflammatory cytokines are flowing into our systemic circulation, and when we have increased inflammation in our blood system, then we turn on all kinds of autoimmunity. So, and with this comes pain and perpetuation of chronic symptoms. So I truly believe the biggest thing that you and I can do every day of our life is to try to control inflammation. So we make decisions every day that either are perpetuating our inflammatory cycles or they're helping mitigate it. After this, I plan on going for a run around 10 Lake because I know that that is going to increase oxygen to my body. I'm going to do all kinds of great things for my muscles, etc. And instead of after that going to, binge on Mexican food and margaritas, I'm probably going to go have a juice and have a rest, right? So I'm making decisions that is helping me control inflammation with my own body. So in helping control inflammation, it's obviously about your diet, it's about your gut, it's also about addressing something called methylation that we're going to go into. It's about giving your body the nutrients that it needs, and then also giving, in all of my patients, I just sit down and say this, listen, this is our work together. We're going to find out what's stressing out your body in all the systems that we're going to look at, and then we're going to take out what you don't need, and we're going to try to put back in what you're missing. And sometimes those things that you're missing that are especially nutraceutical, guess what? Your genetics have a major influence on how you process some of these nutrients. And those nutrients are meant to do different things in your body. I hear it less and less, which is great, but I do hear some people come back, they've had a visit with their specialist, and it's really disappointing when it's a gastroenterologist, but it happens. They'll say, you know what, your diet really doesn't matter. No matter what you do with your diet, it's not going to really change anything about your health. And it's so disheartening to me because what do we do if we don't eat? What happens to us over time? Don't we die? Doesn't your diet do something? Can we all at least agree about that? So in intermittent fasting too, we know now that actually there's something that our body, when we're constantly processing foods and we're constantly processing the outside environment to the end, our body really becomes stressed out if we never have periods of rest. So there's actually been some studies with intermittent fasting that if we're giving our body a rest, we're really helping a process called autophagy, which autophagy is basically like how are we cleaning out intracellular debris. So our body gets stressed out, it has all these inputs into it, and if we hit the pause button, it can kind of catch up. So it's more effective when you start eating again. So there's a bunch of studies recently about intermittent fasting and how can it really be helpful for the immune system and autoimmunity as well. Now kids, they intermittent fast, right? They do it because they go to sleep, hopefully, your infant is sleeping 12 hours a night. There's an intermittent fast. If they sleep, and you don't feed them or they delay breakfast and they don't eat until, and this is not an infant, but a little bit of an older kid, and they don't eat until lunch, that's a 16-hour intermittent fast. So I'm not saying fast your infants, let's be clear, but infants, they naturally intermittent fast because they're resting and repairing and they need those long hours of sleep. So this is just a little slide. So what are the principles of core gut health? Like how can you have a healthy gut? So to me, when I really want to figure out, okay, how can I balance somebody's gut? They don't have inflammatory bowel disease where I need to send them off to the gastroenterologist to have a scope, but they have a little bit of dysbiosis. And the word about dysbiosis is you just have, your gut just feels not perfect all the time. Like sometimes you have diarrhea, sometimes you have a little bit of constipation, sometimes you don't know what the trigger is, but all of a sudden, you're gassy and bloated. So in order to really help balance the gut, you got to figure out first what are your allergens. So believe it or not, there are a lot of immune systems that don't like every food that's healthy for us. In particular, one of my favorite foods to eat is eggs, but it's one of the top 3 allergens for a lot of people. So the top 5 are gluten, dairy, egg, soy, and nut. And there are a lot of people in this room that probably have a food allergen or sensitivity that you don't know about. And the thing about food allergies is they're not all that immediate oh my gosh, I ate a peanut, where's the EpiPen? I'm gonna go into anaphylaxis because it's such a severe, exaggerated eosinophilic response. We have delayed immune responses to foods, and those can be food sensitivities. And historically, the allergists are like, that doesn't matter. Those don't, that's just, yeah, that's just kind of voodoo medicine. But what we figured out is if your immune system is having a delayed response to a lot of the foods that you're sensitive to but you're eating, well then it causes inflammatory stress, which also causes autoimmunity and a perpetuation of chronic symptoms. So my biggest pet peeve is somebody that does like a food sensitivity test and they get it back and they say, oh my gosh, I'm allergic to every single thing on this list. I can't eat anything. Because it's always, what is the chicken and what is the egg? Because the catch-22 is if we have a lot of dysbiosis or our gut is imbalanced, we're gonna have this kind of leaky gut situation, right? And so you're actually gonna start reacting to all the foods that you're eating, which you're really not reactive to those foods, you're sensitive to those foods because you actually have more work to do with balancing your gut. So if you don't know anything about what foods your child or you might be sensitive to, you can always go on an elimination diet, and you don't have to have any blood testing to do it. You take out those top big 5 for 21 days, because after 21 days, your antibody response decreases by half, and then you add those foods back in one at a time. 2 foods a day, or 2 servings a day for at least 3 days in a row, and you say, oh, my eczema didn't come back. I mean, any child in this room that has eczema is a food allergy until otherwise proven. And I want you to remember that if you have a kid without eczema. So you add them back in. Did their eczema flare? Did their behavior get worse? Did they not sleep? It's more about just, did I have the bubble guts, right? It's way beyond that. And if they don't, you take it off and say, okay, eggs were fine, let's add back in dairy and see how we go. So you systematically make your way back through the foods and figure out what your sensitivities are. Also, our gut needs a lot of protein. Our kids are eating beige, packaged, processed foods. They are not eating real foods high in protein. So that diversity in their diet is so incredibly important, not only to get protein, but also because they need the phytonutrients. They need the zinc, they need the iron, they need the vitamin C, they need those micro and macronutrients to have all the support for their physiological processes. So that's called phytonutrient diversity. My daughter, she struggles with phytonutrient diversity, but when she eats the rainbow in a day, she's like, Mom, I ate the rainbow. Look, I had this, that, the other. So we have a goal to eat the rainbow every day. So don't just eat the same stuff all the time. Your body wants to see different things. Because guess what? There are different microbes in different foods, and we are comprised of trillions of microbes. That's what we are primarily in our gut. And when we do things like eat a diversity of food, and fermented foods in particularly, our bacterial diversity increases within our gut. And there's so many studies now about the microbiome, about diversity, etc., that we're just on the brink of really, really understanding different microbes and what they do. But the consensus within our community now is we need lots of good bacteria, and we need lots and lots of diversity. So with kids in particular, when they're eating those packaged and processed foods, they're missing fat. And half of your brain and dry weight when you're a child, it's fat. You need fat. You need good, healthy fat. And not all fat is created equal. Some fats are super inflammatory, like fried fats, trans fats, fats that have glycolid products in them, like charred, burned meats and fried foods, are actually really, really bad for your immune system, and they junk up your cells and they stress out your processes of autophagy. So we need to get our kids eating more fat, and we definitely need to get them drinking water. I think a child, after 1, should not have a bottle. I don't think that they should drink milk either. Milk is for baby cows. What our kids need is they need real food that provides that calcium and those nutrients. and then they need to drink water. They don't need to drink juice. Juice is full of sugar. It doesn't have the fiber in it. They just need water primarily. So we know also that, guess what sugar does? It causes more inflammation. You ever heard those parents who are like, oh my gosh, don't give my kid that, he'll just go crazy. And then there's the other parent that's on the side going, oh my gosh, this mom is so over the top, you know? But there are some kids, when you give them sugar, their behavior goes crazy. And especially sugar from corn, high fructose corn syrup, is the worst type of sugar any child can have. Because it's the most sweet, and it affects our immune system and our endocrine system in an exaggerated response, what even cane sugar won't. So, another thing that's coming up in kids that I'm seeing more and more when I do labs in, is they have elevated liver enzymes. So your liver has to process the sugar. And we're seeing a rise of something called non-alcoholic fatty liver disease because these kids are eating so much sugar because their liver is having a hard time processing it and it's causing weight gain, etc. But here's a scientific article just saying, hey, guess what? Sugar's inflammatory. So we should try to minimize sugar and always not allow our children to have high fructose corn syrup. I mean, it's about to be Halloween, right? And so your kids are probably going to have a little bit of high fructose corn syrup. But then what do you do after that? You take that candy and you're like, go give it to, I think there's like the candy fairy or something like that. You can go and donate the rest of it. There are going to be times where they go to birthday parties, they're going to have a little bit of this, that, and the other. But most parents and most Americans, they just have sugar accessible in their home at all times. So we can't control everything that our children are eating, but we can control what we're buying for our children to eat and what we have in our houses. Because unless they're 16 and driving a car and have an allowance, you're the one doing the grocery shopping and you're the one putting the food in your house. With traumatic brain injury and with a lot of neuropsychological conditions, you will see that a lot of people go into doing the ketogenic diet. So I'm not a purist when it comes to keto. There are some people that are, you have to do it this way, you have to be in it this long. I've actually seen for some children when they go on keto, they get worse, they don't get better. So I want to tell you about the ketogenic diet with the fact that I don't know if it's worth I don't think that every kid does 100% on the keto. The principles of keto that I really like is, guess what, you don't give your kids carbohydrates and sugar. You focus on high fats that are healthy fats, you focus on protein, and you focus on vegetables. I mean, probably all of us in this room could use with eating more vegetables, right? I love another saying by Mark Hyman. He says your diet should be primarily carbohydrates in the form of vegetables because there's carbohydrates in vegetables. So the ketogenic diet is very high fat to a low carbohydrate diet ratio, around 4:1. The mechanism of action is attributed to the formation of something called ketone bodies. One in particular is beta-hydroxybutyrate that can be very effective in the enhancement of really giving the mitochondrial mechanism the chance to do the work that they do. Strict keto is less than 20 grams of carb a day, moderate is 40 to 50, and ketosis is usually achieved after 3 days, and really when you're in a good amount of ketosis, you can find it on those urinary strips. And so sometimes, because you're spilling out ketones, you can find them in your urine. Sometimes you can find, it can be motivation to say, okay, how strict have I been? Where am I getting carbohydrates and sugars that I might not be aware of? The pitfalls to the ketogenic diet is a lot of people get constipated because what they do is they're like, I'm gonna go low carb. So they only eat cheese and butter and meat, and they have no fiber, right? So they get super, super constipated. And then for kids, I mean, you're limiting things like fruits, which for a child, I think a child should be able, for the most part, to eat every fruit and vegetable that they want. And then if you have a picky eater, it's really hard, right? It's really hard. It has been shown that to enhance the mitochondrial neurologic disorders that the ketogenic diet has proven to be effective in different things, such as drug-resistant epilepsy. A lot of times neurologists will put you in the hospital and you'll do like a hospital-controlled ketogenic diet, but I can tell you what, there's a lot of parents that try it on their own at home. But for neurodegenerative diseases, also like Alzheimer's and Parkinson's, they've shown efficacy with the ketogenic diet, also migraines and autism spectrum disorder, etc. So basically the principle here in the story to me for the people that don't want to do the ketogenic diet is eat healthy fat, limit your carbohydrates and sugar, and eat, vegetables and proteins, right? So when you're eating a low glycemic sugar fruit, you're going to stick to your berries and apples primarily. You're going to stay away from the tropical fruits, your mango and kiwi and pineapple. So here's a depiction of what that beta-hydroxybutyrate ketone is doing with the brain. So being low carbohydrate and more fat. Here's another synopsis of how this principal ketone provided a superfuel for the mitochondria. So who knows about the mitochondria in this room when I'm talking about that? Good. Like we'd all be dead without our mitochondria. Our mitochondria are the things that are fueling energy from the cells, right? And guess what? The mitochondria need a lot of nutritional input from us. They have primary needs. So has anybody ever been anemic in this room, needed some iron? And what's the primary symptom? You're tired. You're tired. Well, iron's one of the mitochondrial's first needs. Other than essential fatty acids, we have to give it iron. So, that's just an example, but our mitochondria need all kinds of other things. It needs carnitine, it needs methylated B vitamins, it needs essential fatty acids, it needs all these different things to really affect and be effective. So here's some other effects of the ketogenic diet. I'll let you read through that. Different oils that are healthy. So what is a healthy fat? Things like coconut oil are a good one to go to. You can cook it at a very high temperature, so the smoke point is high. The most medicinal part of coconut oil is something called medium chain triglyceride oil. You can also put that in like smoothies. You can use it to bake things at a high temperature. Olive oil is a really good oil too, but if you cook it really high, if you cook it above, say, 325, you can increase some rancidity in the oil and actually becomes a really beautiful oil to something that can be considered more toxic. So coconut oil is a good one. It's a good fat. Also avocado, probably the best food on the planet, probably one of my favorite foods. Lots of fiber in avocado. It's a monounsaturated fat, high in vitamin E, glutathione, and you can eat avocado in so many different ways. If you're making smoothies for your kids, that's a great way to do it, is cut up an avocado and put half of it in there. They won't notice it's in there, it just becomes a little bit more creamy. And then other sources of good protein are like grass-fed beef, things that are not packaged and processed in a factory, but actually animals that are roaming and eating raw grass. So my husband, I've finally gotten him on board that we should try to get the cleanest meat possible, because at first he's like, it just doesn't taste right. It doesn't taste right, Emily. But eventually, if you get a really good source, you learn to adapt from what is synthetic to what is real, and then you actually start liking the taste of real beef instead of the other stuff that's cheaper at the grocery store. Broccoli is something that's also on the ketogenic diet. It's high in protein, and it's also high in fiber, low in carbohydrate, but it also has something called sulforaphanes in it. And sulforaphanes are known to activate something called NRF2 and decrease inflammatory stress. Also, for those that are more estrogen dominant, helps you to metabolize your estrogens. And then here's a depiction of what trans fatty acids will do. So they've done study after study. If you're not putting good fats into your body, right, they can actually increase inflammation instead of lowering it. So we want to be very mindful about the fat that we're using. And things that are fried, no matter how delicious they are, because they can be so delicious, they're one of the worst fats that you can put in your child. So watch, I mean, that's just a really simple thing. Just watch the amount of things that you're frying. They did a study, I was listening to a lecture actually on the way here, that it was a women's study over 15 years at a university. They showed actually the women that ate more fried chicken over this time, they had a 13% increased risk of cancer. So watch your fried products. Here are some things about good oils. There's the coconut oil. I like flaxseed, avocado, and grapeseed. Dr. Arashban, she's she's a cardiologist, integrative cardiologist. She loves algae oil. So you can find algae oil in Austin, only at Central Market. You can't find it at Whole Foods, I'm not sure why. But algae oil is another one that's tasteless, and you can do it at a very high oil. And she really promotes that it is probably the best oil for our heart. Algae oil. Algae oil, yeah. So, addressing methylation. Who's heard about methylation or what that is? Good, good. You know, when I first started studying functional medicine, it's like, okay, so I just need to take some more vitamins and I'll be good, you know? And I've quickly learned that not all vitamins, our body doesn't synthesize those vitamins the same way that maybe I do from someone else, right? So methylation is this process. It's this biochemical exchange of one carbon and two hydrogens where we're taking a chemical, we're breaking it down, we're making it into another structure that feeds a physiological process in our body. So it's like you put something in and then it comes out a different way, right? Our body's processing that all along the way. So methylation is something that we take our foods primarily and we get the chemicals that we need out of them. Like for instance, folate is a huge one for kids to understand and know about. The folate cycle here, so these are some biochemical pathways. The folate is in the middle. And really folate is a life-giving nutrient. That's why when you get pregnant or you want to get pregnant, what does your OBGYN say? You must take folate. You have to take folic acid. So we dumped folic acid into the food system and we dumped it into all of our vitamins. And what we figured out is actually a lot of people have problems processing folate or methylating folate. So folate is really important because it also feeds the neurotransmitter cycle. It helps build dopamine and serotonin. It helps mitigate inflammatory stress. It helps us process our toxins in the methionine cycle and the transsulfuration cycle. So I won't bore you with this, but take my word for it, folate is very, very important. So the form of folate we see a lot is that kids need that they don't have or they have a hard time processing is something called methylated folate and folinic acid. So there are some genetic predispositions that you can have genes that help you not process your nutrients the way that you need to. Let me tell you a story about myself. I have a 16-year-old now, I just have a 12-year-old. But my 16-year-old rocked my world. I had terrible postpartum depression. At one point, I thought I had postpartum psychosis. It was so bad. And it just changed my life dramatically because I was from a happy, healthy, well-functioning person to all of a sudden I was so depressed I didn't even want to hold my baby. And I actually was afraid to be around my baby. So when I figured out, after being on Lexapro during that time and kind of getting my mood stabilized, I couldn't get off my antidepressant. I was like, well, I've been to therapy, I've done all these things, I've worked through my trauma, but I'm still depressed, I still have this depression. And when I started studying nutrigenomics, or how our genes affect the processing of our nutrients, I figured out, guess what, I don't make folate. You can give me all the folic acid you want, but I can't make this methylated form that's one of the building blocks for serotonin. So once I started with myself repleting folate and giving myself the right types of folate, I worked with my psychiatrist at that time and I'm like, you know what, I know you're gonna think I'm crazy, but here's what I found, and this is what I wanna do. And we worked together and we weaned me off my antidepressant, and I haven't been on it since. And that was about 10 years ago. but it was all about my processing of folate. If I just had the right type of folic acid, I could have not needed that Lexapro. It could have mitigated some of my stress post-pregnancy. I don't regret having postpartum depression because it was the impetus to adopt my daughter, which is probably the best decision I've ever made in my life. But going forward, you know, when I see people, when they come in to see me for depression, that's one of the first things I want to understand is where's your folate? But there are other things in kids, like your FLOR1 gene in particular. This gene can prevent you from not only making that methylated form, but the folinic acid form of folate. And in fact, in autism, they're doing these really big studies now at Harvard that talk about if we give kids actually high levels of folinic acid, it's improving every single symptom of autism. Your neurological system needs to have methylation support. And kids in particular need folinic acid. It helps build and repair DNA. So there's other things that predispose you to having neurological stress, like your catecholaminomethyltransferase gene, your ApoE gene with processing sugars and lipids. You even have something called your brain-derived nootropic factor gene, which helps you make your brain growth hormone. So our genes really influence how we process our foods, which is important to know. So again, if we look at the functional medicine model, this would be like a predisposing factor, and then we have a trigger, and then what propagates the disorder is if we can't find out where is the inflammatory stress and how do we get rid of it. So if you have a kid that had a brain injury, and before he did fine on his, you know, McDonald's and poor sleep and high fructose corn syrup and, you know, extra stress around this, that, and the other, the resilience after a brain injury could be very different. So now taking those other parts of his holistic picture and really saying, okay, where can I do an improvement here? How can I do an improvement here? And most people, it's through their diet. I can't say it enough. I'm not a nutritionist, but I value nutrition for more than anything I do in my practice, hands down, because it makes the most difference. So this is something that I do in my practice a lot. I look at biomarkers. I like data. I think data helps drive change in decision making. There's some patients that will come in that they're like, listen, I have a limited budget for labs, and I'm like, okay, so we can do this without having to get labs. And, you know, they're motivated and they're ready to make change. But there are other people that come in and you've got one mom over here saying, yes, I can't wait to get started. And then the dad's like, I don't know who you are, what this functional medicine business is. And I'm like, well, I'm going to show you the data. So there's data that even your pediatrician can do. You can look at your C-reactive proteins or your high sensitivity C-reactive proteins. You can look at fatty acids and magnesium and folate and vitamin D and homocysteine. You can look at these markers, and if your pediatrician or provider is going to partner with you, they can run them through CPL. You don't need any kind of special functional medicine test to do this. So this is the optimal ranges. That MTHFR down there means you probably need some folinic acid and some methylfolate if you're a child. Glutathione actually helps you process your medication. It's your most potent antioxidant in your body, and it's like the cleaner for the liver. That's how I think of glutathione. I think glutathione is increased when you do HBOT2. I'm not sure. Yes, Dr. Womack says yes. So you can actually look at these as biomarkers on serum. So here's some nutraceuticals that I found helpful with traumatic brain injury. You know, vitamin D, of course, can be very helpful. Nature's anti-inflammatory is curcumin or curcuminoids. We get that from cooking with turmeric. Glutathione, magnesium, essential fatty acids, and methylfolate. We're going to go into these just a little bit. How much time do I have? 15 minutes? Nobody knows. We'll go fast. So this is just talking about how we can lower inflammation from diet, and guess what? There is a study, and it is valid, and it is scientific. Here we go with omega-3 fatty acids, because most of my patients come to me on supplements. So the fact is, I try to make them the most effective supplement that they can possibly be purchasing. So for instance, omega-3 fatty acids, nobody needs omega-6s. You only need omega-3s. We have so much omega-6 in our diet because it's primarily found in grains. So what we want to do is focus on, for anti-inflammatory effects in particular, is only omega-3s. And then there's this balance in our body that we want to achieve. Really, like a 1-to-1 ratio is ideal. If I do an essential fatty acid profile on people, I say that they have something like 100 times the omega-6s that they need on a consistent basis. So guess what? I just quit doing them because I'm just under the assumption you have too much omega-6 and not enough omega-3. So when you supplement, you want to go through omega-3s. And here's the thing. This is so important. I wish I had the clicker. But omega-3s, it is actually, they have so many anti-inflammatory properties to them. So, it starts off with food. Omega-3s you can find in things like flax seeds, walnuts, soy, if only if it's organic. Canola, I don't necessarily 100% agree with, but hemp as well. So you can add those to your diet and they'll be high in omega-3s. But those omega-3s, if you look at kind of this fatty acid pathway, over time they become something called EPA and DHA, which we've known with study after study that EPA and DHA helps lower inflammatory stress. And with the brain, usually you want more EPA to DHA. But the thing about it is if you're giving yourself omega-3 fatty acids, but then you're eating a lot of sugar, guess what happens? There's this enzyme called delta-5 desaturase. And you take those good anti-inflammatory omega fatty acids that are so good for your brain and your body, and it shunts them towards the most inflammatory fat you can have called arachidonic acid. So sugar converts the good fats to the bad fats because you have this upregulation of this enzyme through having too much insulin. So, it can be a catch-22. Here's your omega-3 fatty acids with your 8, Smarty Pants. Smarty Pants, they're chewable vitamins, but each one of them are just coated in sugar. You just give your kid a handful of candy every day if they're on Smarty Pants. So it's like you're just kind of mitigating. You have good intentions, but in the same sense, then you're having some of this happen as well. So this just says we should have more omega-3. Don't get a fish oil that has omega-6, and you want to have EPA and DHA in it, usually more EPA. And the dose is, and I'm going to quickly go because we're running out of time. Here's it for vegetarians because some people don't want any animal product. And here's that wonderful algae again you can do, and you can also do a lot of chia to get it done. But also, let's see here, the inflammatory thing is, so a lot of people dose matters. So if you're giving your 3-year-old 500 milligrams of EPA and DHA of fish oil, it might not be enough. So studies in adults show, we got 1 minute. Woo, we gotta hurry up. Studies in adults show that basically, you can underdo it with essential fatty acids, and you really can't overdo it. So in adults, you have to give them more than 7 grams a day. That's a lot of fish oil. In kids, I usually aim for 1 to 4 grams, 1 in the younger kids, up to 4 in teenagers. So when you underdo it on your fish oil. Turmeric's another very, very, very powerful anti-inflammatory. So if you don't want to have to be giving ibuprofen every day or Tylenol, which by the way, Tylenol depletes glutathione in your liver, and it's like, I wish it was off the market. I despise Tylenol. So I always go with ibuprofen instead. But turmeric is nature's anti-inflammatory. You need around 750 milligrams of turmeric. And here's all the literature behind turmeric. It's just amazing what happens to your inflammatory cytokines and all the inflammation when you give enough. And usually with turmeric, you use a little bit of black pepper with it to help increase absorption, and you do it around 750 to 1,500 milligrams a day. So we all know we need vitamin D. Anybody that has their kid have blood work done, get a vitamin D level at least once a year. You want to aim for something around 70 in the serum level. Most pediatricians will do it and says, oh, well, you're at 21, you're fine. You don't need any vitamin D. That's not the truth. Vitamin D does a lot of beautiful, wonderful things. Let's optimize it on the value. We could go over all what happens with vitamin D. Here's methylfolate and how we metabolize that life-giving nutrient folic acid. from folic acid into the methylated form and the folinic acid form. Here's glutathione and how wonderful it is for your liver. Magnesium does over 250 things in your body. Magnesium is beautiful. For most kids with brain injury, they need magnesium. And I tell you why. It helps lower inflammatory stress in the brain. It helps mobilize the bowels. It helps you sleep. It helps you process your hormones. Magnesium is something you should all consider. I want to warn you though, magnesium that stimulates you to go to the bathroom is called magnesium citrate. And so if you give too much, you're going to have a kid with diarrhea. But if you have a kid that's constipated, magnesium citrate actually is a great form of magnesium to give. The magnesium I like best for the brain is something called magnesium threonate. It's just processed a little bit more in a way that's more absorbable through the blood-brain barrier. I find it to be very helpful for helping get your kids to sleep, for getting your kids less anxious, and for getting them to have daily bowel movements, because what is pooping? Why is that so important? Other than the fact that we can dilate our bowels and have obstructions, and even in severe cases have to have surgery, it helps us to detoxify. We're emptying our trash cans. So I'm constantly telling my little kids, I'm like, what happens when you don't take the trash out in the kitchen over time? And mom made, something to eat yesterday. And then it gets higher and higher. Your kitchen stinks, right? We all need to take the trash out, and that's part of pooping. It's very important. And kids, especially with traumatic brain injury, that you have to think about their bowels and get them moving. So you can always also get magnesium through Epsom salt baths. That's really nice. The thing about Epsom salt baths, a lot of people don't do enough. They do like a cup or a teaspoon. You get a half a bag. I like Dr. Teal's. It's just half a bag. Soak your kids in there for 20 minutes at least, and you're going to get some magnesium salt. We don't have a lot of time to talk about intermittent fasting or brain-derived nootropic factor. My partner and I wrote a book this year, and it's about the functional medicine approach to autism. However, it can be applied to any chronic childhood illness, even traumatic brain injury. We have free ones on the table. You can grab one if you're interested in learning more. And that's it. We were going to talk about pharmacovigilance and knowing how to buy what supplement and which brand, etc., but we're out of time. So that's it.